All right, team, this is cool. So we got Dr. Arredondo here today, and we're going to talk a little bit about BBL safety. You know, we get the question all the time because BBL is one of the most common positions that procedures that we perform, but about safety from this, because no question it looks great. Bikini season's still here. Texas is bikini season most of the year. But ultrasound has been one of those things that's really changed, and the societies have made some changes in terms of recommendations.
Absolutely. Now it's becoming standard of care to use ultrasound in all these procedures to make sure that you're doing the most safe procedure that you can.
And it's one of these things that we've really adopted and we've been doing for months now. For those of you who follow us on Instagram, for those of you longtime viewers, sometime DMers, you guys have seen this for a long time. You know, we use a Clarius ultrasound, but there's lots of good things out there on the market. Let me show you what we're talking about, because, you know, we used to do it by feel, by a lot of anatomical. Now we're actually seeing the body when we're doing this. So we can actually see you while we're I don't want to say doing you, but while we're doing your butt, you know. So you can see here, and this is a picture of a picture, so bear with me, I promise it's a lot clearer in person, but here's all the muscle, here's the fascial layer, and then here's the superficial fat, the deep fat. The nice thing now, not only from a safety, but for a lot of you that are wondering, you know, we can really augment this butt in ways that we never could before. This is what's super exciting, you know, because each of these are basically fascial compartments that contain that butt, but now we can fill a deep layer, we can fill a superficial layer, which just gives us more control than we've ever had.
That's right. By targeting each layer individually, we could put more fat in each spot and make sure that we have a higher retention of that fat, which is the whole goal of the procedure.
But safely.
Safely, exactly.
And the idea too is that, you know, projection, you guys have heard me talk about, is one of the hardest things. If you think about it, if you're only filling one spot, there's a limit how much you can do that. Then people start to get wide, you don't come out, and now we've got different spots that we can do. And we'll show you a little bit here. This is us. This is just want to show you me while we're working on you, but you can see what we do. So I'm looking at you while I'm working on you. And so we have our ultrasound, we have our fat, big cannula safely, so we can see exactly where everything is, and that way it really holds it into a good spot. You can see that with the smaller ultrasound, you can really control everything. You know, this was a picture of it, and so I'll show you. So here you can see the muscle, there you see the deep fat, there you see the superficial fat. That right there is actually our cannula. That's James in the background, but you can see the fat head right there, the cannula coming here. So we do a retrograde technique, so we can actually see the fat being layered as we're going, and we have super control over that, which is not something new, ultrasound doing treatments. You did a lot of this in general surgery before you did plastics.
All right, we've used ultrasound in medicine for years and years and years, but this is just the next great application of that technology. And
so plastic surgeons were just slow to adopt it.
Slow to adopt it? I don't know. We like to make sure things are safe before we do it, and I think this is just the next evolution. The great thing I love is you just see it filling as you go. So this isn't something you see afterwards, you're taking a guess. This is, you know exactly where you are, you see it fill the area. There's no question when you're doing it that you're putting it in the right spot.
And I always tell people, one of the things, the reasons that it took so long is some of these little ultrasounds, because in the past they were really big, really bulky. It was really hard to do it in practicality. The nice thing here is that this is basically the size of these new iPhone Maxes, maybe smaller than the new iPhones. We'll find out tomorrow. But you know, the idea is that we can actually hold it, it's battery packed, Bluetooth right to our iPad, and so you can see everything real time, which is super cool. I'm excited. I mean, the uses, the safety, the results that we're going to get for people is going to be unparalleled.
Absolutely. You don't have to lug around a 200-pound machine, something that weighs like a phone, completely sealed, completely safe. It's fantastic to use.
Boom, boom, boom. Ultra safe BBL explained to you guys. Yay. We'll see you guys. Bye.
Bye, guys.
All right, team, this is cool. So we're going to actually show you a little bit of action because we talked about it, but we'll see it in action. You can see this white glob here is actually the fat. So there's the fascia, deep fat, muscle, superficial, you know, so that's the fat coming in. You can see it's got a different color. We'll hit play, and then you can actually see our cannula tip. You see it right there? Slowly coming back, and you see the fat being deposited as we're just kind of coming with you just like that. So that was super cool. See it in action. You're welcome. Did you like it?
That's the magic right there.
Yeah, that's what I'm talking about.